We're here today with DA. What I'd like you to do is explain what kind of problems did you have? What caused it? What kind of therapies did you have until now? What did we do differently in our office, and how has that improved?
Sure. So about a few years ago, I was having very bad headaches. I had seen a doctor and they had prescribed prism lenses for me, which worked for about 2 months. And then for every 2 or 3 months I would have to go back and get a new prescription and change my prism. So I've been working for 2 years with a doctor. And my headaches were probably about a 15.
A 15 out of 10.
15 out of 10, yes.
So on a scale of 0 to 10, they surpassed that scale.
Absolutely.
Right.
I was on medication for my headaches daily, for me just to be able to cope on a daily basis. I, on the internet, found Dr. Roth, started some eye therapy, and within 4 weeks, my headaches are gone.
That's awesome. Okay, because you were on a pretty strong medication and had to use that daily, and you were using that daily for about 2 years?
Correct.
Okay, and what we did, why don't you explain a little bit about what Syntonic phototherapy is?
So Syntonic phototherapy is, I started out with what's called cupping. I would cover my eyes for 2 minutes, and then I would stare at a light, which was given to me by Dr. Roth, and special glasses. One pair of glasses, I started out with 5 minutes, and each day I got to 6 minutes, 7 minutes. I'm up to 10 minutes now, and I've been doing that now for 3 weeks.
And these are special filters that have different wavelengths within them, and you have 2 different types of goggles.
Correct.
The first one that you use, and started out slow and built up to about 10 minutes, and then we do the palming, and then you've been using the second set, and what this has done is, from what you're describing, it's brought you into better balance. And you described to me before how, as I said, on a scale of 0 to 10, your headaches exceeded that to a level of 15, and then after a week it was down to a 10, and then it reduced down to a 7 and 5, and today it's about a 2. And you can do what you want to be able to do. Tell me about driving.
Yeah, so I don't really have any issues driving without having headaches. I have no issues.
And tell us about computer, like when you work on your computer or look at your cell phone.
Yeah, so it doesn't give me a headache anymore. I can see, I don't have to get a headache, I can do my normal duties.
And one of the other things you described was when you would bend over to play with your dog. What would happen then?
I was very lightheaded, and that I don't have anymore.
Wonderful. So has this made a significant improvement in your life?
Absolutely.
And I'm so appreciative of you allowing me to help you, and within a matter of just 4 weeks, you've made some huge improvements. I'm so glad we were able to help you get off of that strong medication that tried to compensate for your headaches. If you would, go ahead and share that with your neurologist or the doctor that prescribed the medication. Anything else that you want to add?
No, I just want to thank you, because now I can finally function.
Wonderful. Thank you so much.